This is Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. On the show, you'll hear from innovators in the food space. We'll have disruptive conversations with people from around the globe who are taking the lead on topics like food sustainability, ending world hunger, food security, and so much more. I'm your host, Paul Newnham. On today's episode, I'm joined by Priya Prakash from HealthSetGo. Priya founded HealthSetGo 10 years ago after her own experience struggling with her health growing up in India, and today the organisation runs school health programs right across the country. In the conversation, Priya breaks down the state of children's health in India, and she shares what HealthSetGo is doing about it. You'll hear why India's definition of the word healthy might not mean what you think, the hidden health crisis facing girls in Indian schools, and how HealthSetGo is trying to end hidden hunger in children with something as simple as a gummy. Hi, Priya. Welcome to the show.
Thank you. Thank you for having me.
It's so great to be chatting. So why don't we start at the beginning? Let me know, where does HealthSetGo really begin for you?
So first of all, this is the 10th year anniversary of...
Oh, wow. Congrats.
Thank you. And I feel like I'm aging myself by saying that. But HealthSetGo has kind of been a culmination of a lot of things in my life. And where it really begins is with a passion to bring health to children. And why I have that passion is a very personal story to me. So while I was growing up in India, as you know, India is a very food-focused country. You know, it's a wonderful place where a lot of things are celebrated. But I think one thing that is not really that celebrated is health. So while I was growing up, health was never really a focal point for my family. So for me, my younger sister, the rest of the people in my house, I think food was something that we all really came together on, and we kind of celebrated that as a family. But it had a very negative effect on my health growing up. So when I was born and, in my early childhood, I've always been overweight as a child. And when you're young, it's not something that you really think is a problem, or it's not something that even my parents or my family thought was something wrong. Because in India, surprisingly, the word healthy refers to a child who is well fed, comes from a good family. So for example, if you saw a child who is not bigger for their age group, you would actually say that, oh, why don't you feed them more? Why don't you, the parents are not taking care of this child. So when it comes to the definition of the word healthy, especially when it comes to kids in India, it's a misnomer in many ways. And so for Indian standards, I was a healthy child. I was very well fed. My parents really focused on education as the main thing. They never put me really into any sports and physical activity. And that resulted in me, of course, putting on weight. And when you're young and your identity is not really focused on how you look, it was absolutely fine, right? But as I grew older, that is where I started to realize that the way I look was not socially accepted, and by which I mean that I was bullied in school. And that really, really impacted me, not only at a mental level, but I thought that there was something really wrong with me. And I remember spending countless hours just crying about it, feeling helpless about it, that why are these people zoning in on a part of me that I didn't feel like I had any say over. I somehow dealt with it, but in my mind, all I ever wanted to do was fit in and look like everybody else. And it's not something that I could go to anyone for. I didn't have anyone supporting me. And I didn't know that this was a health issue. So it was only after school, it was when I went to university, that is when I really started reading up about how I can take control of the narrative for my own body. And slowly but surely, and this was a journey I had to take on my own, I started to research about what it means to eat healthy. I started to see, okay, if I want to become fit, how do I do that? Until that time, I had never stepped foot in a gym. I didn't know what that was. So when I came on the other side after a lot of struggle, because I think this is something we can all relate to. Health is not an easy thing to do, especially when you're coming off of 20 years of, living a very indulgent lifestyle, right? So for me to break those habits, change that, it took me a lot of time. And then when I was on the other side, I knew that I was really passionate about doing the same thing for other people. And I knew that if I had these tools, the ones that I learned by myself when I was a child, maybe I could take control of the narrative for myself at that time instead of really going through everything that I went through. So that is what really inspired me wanting to get into health, specifically help children who are my age and they are struggling with their health. How can I help them? So that is how Health Set Go was actually born.
Amazing. And thank you for sharing this story. HealthSetGo obviously is continuing to develop, and we'll talk a bit more about what you're working on at the moment. As part of that journey, you were recognized in Forbes 30 Under 30 Asia, and that early recognition, how did that impact your path as you were kind of also working out what all of this meant and how you were driving it forward?
So when I started Health Set Go, and these were the early years, when we got these recognitions at the time. I mean, of course, I was in my 20s, and I think for me, getting recognized at a global level, of course, it was Forbes 30 Under 30 Asia, then Forbes 30 Under 30 India recognized us as well. And then we got a couple of global awards like the Global Citizen Prize, the Cartier Women's Initiative Award. And I feel like these awards, they are good to have. But I know that, in a country where there are so many voices, it's hard to find a proper platform for really speaking out about the issues that you are working on. I think these recognitions gave us that platform. For me specifically, why I really appreciate these recognitions. Number one, because female entrepreneurship, even in India, as a thing is very, very underrepresented. So I think for me to see myself out there, knowing that I'm doing something and working towards something that is recognized by not only me, but a lot of other people as an important enough thing to be working on. And secondly, for our cause to get a platform, I feel like these awards have done that for us. Honestly, I'm not somebody who is in it for the awards. They're nice to have, and they have helped us. For example, one of the most helpful awards for us has been the Global Citizen Prize. I mean, not only did they give us a large platform, they also gave us significant funding for the initiative that we were working towards, right? So some of these awards are for visibility. Some of these awards are for actual funding to your work, and some of them are just to maybe validate your own work. But did it add any other element to what we're doing? No, because for us, we know that this is a very long journey. As I said, 10 years has passed and probably another few decades up until we can keep working on this. These things come and go, but at the end of the day, we are getting these recognitions for the work we are doing. So I never ever would do it for the recognition. So they have been a good contribution, but not our focus area, I would say, for sure.
Was there a lot of pressure winning all those awards and then feeling like I now need to do something differently, or did it open up doors that you didn't expect?
I think so two parts to that. First of all, I have major imposter syndrome. So, sometimes when you get recognized, I mean, I am working on it. I'm working on the imposter syndrome. But sometimes when you get recognized for something at such a large platform, you almost don't buy it. My mind immediately goes to so many other people who are doing such amazing work. So if there's any pressure from outside sources, I feel like that cannot compete with the pressure I already put on myself. I put a lot of pressure on myself to do things that I'm doing right now in my life. And I know that I have a mission, I have a purpose, and I don't think these recognitions can put more pressure than that I put on myself, honestly. So that's from the pressure side. I take my work seriously with or without. But in terms of doors, I think yes. Like I said, it provided a platform for us. It provided actual funding for us in a time where we really needed it. For example, when the COVID-19 pandemic was happening, we got, for example, $250,000 as a grant, like a no questions asked grant from one of the awards that we received. So these are the kinds of things that really help you in times when you need it. And which is why when we get such an award, you have people reading up about us. In fact, one of the government partnerships that we had in India, one of the heads of the food authorities of India, like the Food Safety and Standards Authority of India, he saw me in a magazine and he told his office to call me to collaborate with HealthSetGo. And that was wild because I had been trying to reach out to him for so many years and it never happened. We were never able to crack that barrier. And then suddenly, because of that, so sometimes these dots click. Form is important. Yeah.
So can you tell us a little bit about how HealthSetGo actually works on the ground? What happens when a school signs on? What does that look like?
So for HealthSetGo, it was extremely important for us to empower every school with a basic standard of health. So one of the facts about India is that less than 1% of schools in India actually have a school-based health program, which is something that internationally schools take for granted. I mean, if you look at schools in the US, Canada, etc., other developed countries, the government has a very strong program for schools. Of course, there are good and bad points of every government intervention abroad as well. But when it comes to India, even a basic health program, whether it's health education, whether it's preventive health, whether it's providing that health infrastructure in the school, these things are not really present in most of the schools. So when I started HealthSetGo, one of my biggest motivations was, how do I get every school in India to a basic standard of healthcare? And one of the things I noticed is that schools, by definition, are focused on education. They have educators, they have teachers who probably don't really have the knowledge of how to even run a health program in the school. That is the gap that I saw where HealthSetGo could come in and bridge that gap and say that, what, if you are not equipped as a school to manage a school-based health program, we will come and do it for you. We will come and provide three things in your school. One is that we will provide a preventive health program in the school, which means that we are going to give your school access to a team of doctors who will come to school once a year. They will do a health checkup of every child, the dental check, eye check, anthropometric assessment, which is height, weight, BMI, a full physical examination. We will come in and do that for you if you don't have the infrastructure to do it yourself. And we will make sure that that information that we get out of that is given to you as a school, so you understand what percentage of children in your school have what potential issues. For example, is there a hygiene issue in your school? Is there a dental health issue in your school? Do you need to maybe focus on menstrual hygiene education, right? So you as a school will know more about that. And each of those children, their individual parents will also get access to that information, so that if there's anything, for example, if a child has an eyesight issue which went undetected, the parents can know about it and they can take preventive action for that. So that was the first big pillar that we wanted to put into schools. Secondly, health education, which is something that I believe is the most important thing. It's something I wish I had. So we gave a health education program to schools, which has nutrition education, mental health education, physical health education, and sanitation education. So these are the pillars that we work on. And the third is the health infrastructure in a school. So many schools don't have anyone certified in first aid. This is, children spend 8 hours a day in school. There is no first aid training in that school. They don't have a nurse practitioner. They don't have a paramedic that they call. So we wanted to empower schools with that as well. So today, the program that we have, it provides schools with a bare minimum standard that they can instantly make their school a health promoting school. So that is where we started. Of course, now we're working on a lot of other initiatives as well, but this was the mission.
And so when we think about the area of health and nutrition for women and girls, what are we still getting wrong?
I think for us, we've worked on both sides of the spectrum in terms of the types of schools we work with. So India has a huge private education system, okay, which means that out of the 400 million children, approximately 50% of them go to a private school, which is not funded by the government. That is the definition. And then the rest of them go to public schools, which are government schools. And children in both of these types of schools have different health issues. That's something that we've observed. When it comes to children in the private schools, you see a lot of women. I would say girls. Women I cannot talk to. We mainly work with teenagers and, maximum to the age of 17. So when it comes to their health, what we are seeing is in the space specifically of nutrition, a lot of issues that are going on. So one of the issues in the urban segment, for example, PCOS, hormonal imbalances, overnutrition, children who are overweight, obesity, which then leads to thyroid issues. So we're seeing all of these crop up in very, very young age groups. And this is just the physical side. We also have mental health impacts when it comes to women. We have body dysmorphia disorders, we have eating disorders. These are the things you see in the urban context. But when it comes to the rural context, you see a lot of other things. For example, one of the biggest things being anemia, which is iron deficiency, which is surprisingly also there in the urban space. So a lot of these things are hidden in many ways. They don't come to the forefront. People think that just because they are girls, they are kids, they don't have any major health issues and they can do whatever they want and we don't have to, come in and really help them out. But that's just not true. So I believe more light needs to be shed on that.
So when you think about that, are they these kind of invisible barriers not being talked about enough? Like, why are people not addressing these things for women and girls?
I believe because it starts with the culture in the country. I feel like women and girls in general, we are still waking up as a country to the fact that they are important to look at. It is sad, but it's true that a lot of these, like a lot of solutions, a lot of entrepreneurs, a lot of organizations, they simply ignore this group of people, like I said, mainly for cultural reasons, which is now rapidly changing. Like I said, the more women have a platform, the more we are talking about women's issues. We're talking about menstrual hygiene. We're talking about hormonal disbalance. So there's a lot going on now in the last maybe 5 to 10 years in India. And now I would say these solutions are slowly cropping up. For example, our organization is also focusing on solutions for this kind of age group. For us, it's not women, it's teenage girls, adolescent health. But I think people are now working in different areas to solve these problems.
So as a woman who's built a healthcare company from scratch, what's been harder than most people would assume?
Because you phrased it as a woman, as an entrepreneur, everything is, everything goes wrong when it has to. There's always hard days, more than good days. But when it comes to being a woman, I always like to give a more positive response to that, simply because, like I said, things are changing now. A lot of the recognition that we got and a lot of the support that we got is because I am a woman founder and people are now looking to highlight women entrepreneurs. So it's actually a great time to be a woman in business in India. It's a great time to be a woman doing any kind of work in India, because India has really woken up in the last couple of years to say that, okay, you know what? Here are women building real solutions and women are doing a lot for the workforce. Women are just integral parts of the ecosystem equally as everybody else that has been working. A lot of male dominated fields have been doing for a while. So I would say more than a struggle, I it has been welcoming to women. Honestly, I can say that. I have seen the impacts of the patriarchal mindset in India. I have walked into meetings where they refuse to address me versus addressing my male colleague. There have been a lot of things, but the percentage of that has been much lesser than the more positive experiences I've had, honestly. And I mean, we've worked with the government, which the government is unfortunately male dominated. Literally walking into a room full of men, older men. And for me as a woman, and I think women will relate to this, you always scan people when you walk into a room, who's judging you, who is giving you those eyes like you don't belong here, who is trying to. I did not get that. And I was really shocked and surprised, which means that they are welcoming to not only a woman's voice in a room full of men, but also a younger perspective. Because it's not only that I'm a woman, I'm also a young woman, it's which further should be negative points for you. But I think it has changed, not to the extent across the country, but it's changing. I will agree.
So in your work, how are you rethinking not just products, but also the delivery and affordability of the work that you're doing?
Yes. So, for us, we have been constantly iterating what we do. What I started with 10 years ago is not what I'm doing right now. When I started, I was very young and I thought the world is just going to welcome me with open arms. Whatever I want to do, people are going to be like, yes, Priya, great idea. We should do this. It really is not what I thought of initially. So initially, everything that I struggled with in school, I wanted to change that. A school should have a nutrition program, it should have a physical education program, it should have this, that, this. And I went to like my first 5 schools, and they were all like, no, no way, sorry, but no. And I said, and that was quite disheartening at the time. But I took it as a challenge. I said, you know what? We want to meet our beneficiaries in the middle. If we are going to work together, then we need to meet at a point where we can go together with this. And I understood the wisdom in that. So, today, whatever we do with schools, it has evolved over a period of time to something that schools accept, schools want, something that is benefiting the children in the way that we want it to, because it's a collaborative process with the people we work with. But there are still some things that through our time we noticed as huge gaps. And that is where we have recently been trying to innovate in that area. And one of the biggest areas that we have been trying to innovate in is in the area of malnutrition. So, when it comes to malnutrition, there are a couple of sides to it, right? I am talking about specifically hidden hunger, which, if I have to say it in a deeper way, deficiency of key vitamins and minerals, micronutrient deficiencies in children. So we've constantly noticed every time we send our doctors to schools, specifically in the underserved communities, in the government areas, we have noticed the impacts of that. We can see through data that these children are really suffering because of key vitamin deficiencies. So, what are these vitamins? These are iron, vitamin D, folic acid, zinc, some minerals as well, right? So, one of the largest programs that the government is doing right now is the midday meal program in India, where every child is provided in the government schools a midday meal, for the school lunch. And unfortunately, even though it solves the problem of hunger, it is not solving the problem of hidden hunger. Can we build something innovative that can be provided to these children in conjunction with what the government is already doing, so that we can give them holistic nutrition? And that is where today we have launched a new initiative. It is called Gummies for Good. And we are utilizing the modality of gummies as a format to provide the essential recommended daily doses of micronutrients, which are vitamins and minerals, to children who need it most in these underserved communities. So we are reaching out to governments, we are reaching out to midday meal providers, we are partnering with a lot of local and international organizations to really focus on how we can end this problem of malnutrition, because we believe we have a solution that can effectively do that.
In today's world, what does it actually take to scale these kinds of solutions? Like, because it sounds like this kind of innovation's needed, but how do you go about doing that? How do you change, and like, who's pushing back on that in trying to drive that kind of new way of thinking?
So I have been told by many people not to be critical about what the government is doing right now, but I'm just going to be very candid about it and say that the government is doing a lot of good things in India, but as I said, it's not enough. And it's really important to bring in some grassroots innovations into the conversation. You know, when we are deciding the policy about nutrition, who is sitting on that table taking these decisions? Are there new voices? Are there new ideas being tabled? Are people really collaboratively talking about it? I don't think so. I don't think that these conversations are happening. They are very politicized when it comes to nutrition right now. But I feel like that is where people like me, other entrepreneurs who are working on this, can really come in and say that, you know what, we are happy that you are doing what you can, but we have other ways of doing it ourselves. And in maybe initially, we can scale it independent of what the government is doing right now. Anything new, anything innovative, it takes time for people to really get behind it in a massive way. But in today's day and age, there are many ways to scale an intervention without doing that. For example, HealthSetGo, my whole journey with HealthSetGo has been independent of the government in many ways. So currently, the way we are doing it is to partner with like-minded organizations. We are also working with a lot of philanthropists across different fields who really believe in this cause. Because again, when you have an innovation, I feel you need people from different places who will put in their force behind you, their platform behind you. For example, recently we actually worked with a very large music group from Germany. They were doing a show in India and they had around 30,000 people show up for that show, right? But they said, you know what, we are visiting India and we want to support unique, innovative solutions that are happening, impacting the community at the grassroots in India. So they gave proceeds from their show to us to impact the nutrition of children in India. Now, this is what I would say, innovative models, joining the dots, right? If someone is starting out, you don't always need to follow that road. You can see other ways of doing it.
If there's right now, if you had an average person listening to this on their Monday morning commute, what's one thing they could actually do that pushes things in the right direction? Like how can people get involved and support?
I think it's important to see what you bring to the table, like what can you contribute, and then use your skills / your platform, whatever it is, however big it is, to then create change. For example, if I'm a nutritionist, I think it's very clear how I can create a change in people's lives. But for example, you know, you are not in the nutrition space and you want to do something, you have two options. One is to advocate for better nutrition using whatever platform you have. Do you work in a school? Do you work in an organization? Do you work in a government? Where do you work? And can you advocate for that there? Secondly, what organizations can you support in your own way? But if you are an organization, right? You are a government, you are a philanthropist, you're working in a for-profit corporation that you feel like should do something for developing countries, it is a space that we are very open to collaborating, because we believe we cannot do things alone. We want as many people as possible to offer up what they are good at, and we will do what we are good at. And that's how you solve the problem, right? Everyone listening probably can participate in solving the problem, to be honest.
One thing I like to close out conversations with is a bit of a recurring question that we can all relate to. What's a food memory that's shaped who you are today?
For me, there are a lot of food memories that I have which are very positive from my childhood, which I didn't know were kind of negatively impacting me later on. But food is a very critical part of my childhood that really shaped me overall. I realized that my relationship with food, what food means to me, has just evolved over the years from something that, I used to rely on emotionally to make myself feel better, to something that has now become a source of power for me, a source of energy for me, a source of nourishment for me. And I feel like a lot of people will relate to that because your relationship with food really evolves over time. And I think it's something for people to really think about. Like, what is your relationship with food on a day-to-day basis? How do you look at it? And how can that be a vehicle for you improve your own life? Because that's what food does for all of us. It impacts all of us on a daily basis.
Thank you for all the work that you're doing, Priya. It's amazing work and incredibly important. And thank you for sharing with us your passion for nutrition and health and the innovative work that you're doing around that. So thanks so much.
Thank you so much, Paul. And right back at you. I think you are doing such amazing work for the field of nutrition. And I hope that more and more people are impacted by listening to conversations like this.
Absolutely. I'm sure they'll be inspired by the energy that you're bringing to this.
Thank you so much.
You've been listening to Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. Future Fork is produced by Disruptive Consulting Solutions and supports the SDG2 Advocacy Hub. For more info, head to the website futureforkpodcast.com. This show was produced with strategy and production support from Wavelength Creative. So you don't miss an episode of Future Fork, make sure to subscribe to or follow the show in your podcast app. And while you're there, leave us a 5-star review. It really helps others find the show. I'm Paul Newnham, and I'll see you in the next episode.